In this video, we will be discussing about encephalitis. Encephalitis means inflammation of the brain parenchyma. By parenchyma, we mean the cells of the brain, that is neurons, astrocytes, oligodendrocytes. All these structures, they get involved, they get infected by some organism or some autoimmune process, and it results in a set of typical signs and symptoms, and the whole scenario we call it as encephalitis. Encephalitis can be acute encephalitis, means presenting in a very acute manner. The symptoms, duration of symptoms is not very long. It is within 1 week or 10 days or so. We call it as acute encephalitis. And it can be chronic encephalitis, long-standing encephalitis. It is seen in HIV individuals or immunosuppressed individuals, because these conditions are very chronic, and the resulting uh, secondary infections or secondary diseases like chronic encephalitis, they are also very long-standing. But as far as acute encephalitis is concerned, it is most commonly caused by a viral etiology only, though there can be bacterial etiology also, but the bacterial etiology will manifest as meningitis only. Encephalitis alone is a viral etiology in more than 99% cases. So this demonstration will be restricted to acute encephalitis only, right? Acute encephalitis can be caused by virus most of the times, but it can be autoimmune also. Nowadays, uh, this etiology is also coming into light because of investigations. By autoimmune, I mean caused by anti-NMDA antibodies, anti uh, anti-GABA, anti anti-GABA antibodies, right? Or anti-amphiphysine antibodies. These are a few examples of antibodies which cause autoimmune response to the brain and cause autoimmune encephalitis. It is these autoimmune scenario is seen most commonly with cancers as paraneoplastic disorders of the CNS, right? Virus, we will be, you know, in the coming slides we will try to know what are the viruses which cause the encephalitis, and what is the diagnostic procedures, and the treatment of acute viral encephalitis, right? So as far as definition is concerned, it is inflammation of the brain caused by either infection or from primary autoimmune process, right? Very easy to understand. Clinical features: it is basically an acute febrile illness. Patient will come to you with fever. Encephalitis has altered level of consciousness. The patient will be unconscious. This is very important point. It must be remembered no matter what, because what differentiates encephalitis from meningitis is this symptom of unconsciousness. Third is seizures. So these three features one must never forget: fever, unconsciousness, and seizures. And unconsciousness will differentiate it from acute meningitis, right? So this is very important to remember. Etiology: what is the etiology of encephalitis? Let me make it a little bigger. We have to remember a few of these important points of what do you call it, The common causes of acute encephalitis are herpes viruses, right? Can be arboviruses like West Nile virus, can be enteroviruses. These are the less common viruses. You can remember or you cannot remember. It is totally up to you. But you must never forget. Uh, why ain't it going away? Okay. Herpes virus, arboviruses, and enteroviruses. You can remember these less common viruses also, but these three, they must never be forgotten. Herpes, arthropod virus, enterovirus. Now comes the difficult part. That is which herpes virus. HSV1 is the most common cause of sporadic meningitis. HSV1 we must never forget. Then there is West Nile virus. West Nile virus is a cause of, it is written epidemic encephalitis. West Nile virus. And third is the cytomegalovirus. It is seen in immunocompromised individuals. HSV1 is the most common cause of sporadic encephalitis. West Nile virus is most common cause of epidemic encephalitis. CMV is most common cause of encephalitis in immunocompromised. Right. So this is the etiology. Herpes, arthropod-borne virus, and enterovirus. West Nile virus in arbovirus, HSV1 in herpes virus, and enteroviruses. Right. So this is the etiology. The three that we must never forget is these three: HSV1, West Nile virus, CMV. Now we will come to the lab diagnosis. How do you diagnose? You have understood the clinical features. You have understood the definition. You have understood the etiology. It is mostly viral in nature. So what is the lab diagnosis? What are the tests that we will conduct? The first and foremost is the CSF. You have to withdraw 10 ml CSF when the patient presents to you in the emergency. Second is the PCR. PCR of what? CSF PCR. Uh, CSF PCR. Third will be the culture of PCR. Fourth will be the serology. Fifth will be the imaging like CT or MRI of the brain. Sixth will be the EEG. Right, first of all, starting with CSF, let us come on to this slide. CSF findings. We have to withdraw at least 20 ml. I have told 10 ml in the initial slide, but you have to take 20 ml because 10 ml will go for uh, the investigation at that point only when the patient first presents to you in the emergency, and 10 ml you have to store for later studies like genetic studies. Right, the test immediately that will be conducted will be based on this 10 ml of sample only. Then you do the routine examination of CSF. That is what we used to do uh, in the initial stages only. We do the CSF profile. I mean routine examination of the CSF. What do we see? We see the opening pressure, all the parameters not written here, but I am telling you here. Opening pressure, color, pH, then cells, then proteins, then sugar, then gram stain, PCR, etc. So these are the essential parameters that we study in the routine examination of CSF. Though we will not do routinely PCR, but up to gram staining, that is what we do. What do we see here in encephalitis? See, encephalitis, one must remember that it is the CSF findings of encephalitis are equal to acute viral meningitis. राइट जो फाइंडिंग्स एक्यूट वायरल मेनिंजाइटिस में मिलती हैं सीएसएफ में, वही फाइंडिंग्स एनसेफेलाइटिस में मिलती हैं हमें सीएसएफ में. सो लिम्फोसिटिक प्लियोसाइटोसिस, सेल्स कैसे होंगे? लिम्फोसिट साइट्स होंगे, लिम्फोसाइट्स, पॉलीमॉर्फ्स नहीं होंगे, लिम्फोसाइट्स होंगे. ठीक है, काउंट कितना होगा? काउंट होगा 50 से 100 मोस्ट ऑफ द टाइम्स. प्रोटीन विल बी माइल्डली एलिवेटेड, थोड़ा सा बड़ा होगा. और शुगर्स विल बी नॉर्मल, शुगर कम नहीं होगी, शुगर नॉर्मल रहेगी. राइट, नॉर्मल कितनी होती है? 0.4% ऑफ 0.4 इंटू सीरम ग्लूकोज, राइट, और प्लाज्मा ग्लूकोज. lymphocytic pleocytosis, mildly elevated protein and normal glucose concentration. That is what is the finding of CSF in acute encephalitis. Now here are a few specific findings of the CSF which are seen in certain conditions, like Epstein-Barr virus. We see typical lymphocytes in the CSF, not typical, atypical lymphocytes. It is misprint in here. Atypical lymphocytes means multinucleated, bizarre nuclei. The size or shape will not be normal. So atypical lymphocytes, that is a part that we must remember by heart, that Epstein-Barr virus in CSF will show atypical lymphocytes in acute encephalitis. Atypical lymphocytes, right? Then this is the first case. This is second case. Plasmacytoid or mollaret-like large mononuclear cells. We will see it in West Nile virus infection. See, West Nile virus infection in encephalitis is in itself very much important. So what do we see in CSF in WNL encephalitis? We will see plasmacytoid cells or mollaret-like large mononuclear cells, right? Large mononuclear cells, that is what do we see in West Nile virus. So these two cases you must remember in CSF findings in acute encephalitis. Now CSF polymerase chain reaction has become the primary diagnostic test for CNS infections caused by herpes simplex virus, because we know that the encephalitis is mainly caused by virus. We cannot culture virus, right? It is very difficult, very cumbersome procedure to isolate virus from culture. So what do? We do CSF. It tells us in most of the cases that it is encephalitis or whatever. The second, which is most important investigation in viral encephalitis, is CSF PCR. PCR you have to do to find the exact virus. But the problem with CSF PCR is that the sensitivity and specificity is variable for every virus, right? It is very good for herpes simplex virus, but for all other virus it is very less. Like here it is written that the sensitivity is 96% and specificity is 99% for herpes simplex virus. HSV के लिए तो ठीक है, 96 and 99, and it is even more than biopsy. It is even better than biopsy. So it is very reasonable to do PCR in HSV suspected encephalitis. But other causes, other viruses might not be able to produce the results. It is equivalent to or exceed brain biopsy, right? So for herpes simplex virus, do CSF PCR. It is very yielding investigation. Culture. CSF culture is of limited utility in acute viral encephalitis because it is insensitive. कोई sensitivity नहीं है इसकी. You will not be able to grow culture from grow virus from CSF culture, right? Now serology is important in some viruses like arboviruses, West Nile virus, right? But serum antibody determination is less useful for viruses with high seroprevalence rates like HSV, varicella zoster, CMV, etc. Right? So let me explain to you in a bit detail that what is serology. Serology means we have to detect antibodies against a certain virus in the CSF or in the blood. For serum antibody, we will not be able to uh, detect serum antibody in HSV. Even if we suspect, even if we detect antibody, the seroprevalence of these viruses, that is HSV, varicella zoster, is so much that we will not be able to differentiate the normal individual from the infected individual because it is already seroprevalent in that community. But West Nile virus, in this virus, we will be able to detect the antibody. But where do we detect? We detect in the CSF. If we detect antibody in the CSF against West Nile virus, it is diagnostic, right? Uh, it is diagnostic of West Nile virus, right? So it is very important to understand. Why? Because IgM antibodies do not cross the blood-brain barrier, and their presence in the CSF is therefore indicative of intrathecal synthesis, right? You must remember this. अगर तुम CSF में एंटीबॉडीज ढूंढ पा रहे हो तो इट मीन्स कि एंटीबॉडीज, that is IgM antibody. IgM antibody is a very large antibody, right? It cannot cross blood-brain barrier. If you are able to detect IgM antibody in the CSF, it means it was synthesized in the CSF only. It means it is intrathecal synthesis. If it is intrathecal synthesis, means the West Nile virus is in the theca itself. It is in the CSF itself. So that is diagnostic of. You do not need any further investigation for that. That is already diagnostic of West Nile virus encephalitis. So this is the importance of serology study in West Nile virus, right? It is the sensitivity is 80% or even more, but you have to do this after day 7 of symptom onset, right? कब करना है? 7 दिन बाद. सिम्टम के 7 दिन बाद करोगे तो रिजल्ट अच्छे मिलेंगे. अगला जो हम करते हैं, द नेक्स्ट इन्वेस्टिगेशन दैट वी डू इज इमेजिंग एंड ईईजी. सी एक ही वायरस इंपॉर्टेंट है इसमें टू यू नो टू फॉर द इमेजिंग टू बी रेलिवेंट. हमें दिखते हैं फोकल चेंजेस ऑन एमआरआई, और दिखते किसमें है? दिखते हैं हर्पीज सिम्प्लेक्स वायरस में, एचएसवी में, right? The focal changes on MRI in HSV. Otherwise, there is no much benefit of doing MRI because it will either be normal or the findings will be very much less specific, right? But if you find certain pattern of involvement of brain parenchyma or the cortex, and the pattern is increased signal intensity in the frontotemporal, cingulate, or insular regions of the brain on T2 weighted MRI, flare or diffusion weighted MRI. You can say that this is HSV. It is very much specific for HSV. सिर्फ HSV में ही frontotemporal, insular और cingulate cortex involve होता है. You must know कि where are these cortices present. The frontotemporal, you can very well imagine that what is frontal part, what is temporal part, what is insular part. Cingulate gyrus is kind of very much medial, so you must know कि where are these gyri present, where are these cortices present. If these cortices are involved, it means it is HSV encephalitis because these findings are seen in only HSV, right? Similarly, the findings will be on CT, but we do MRI most of the times. EEG में क्या मिलेगा? ये तो रटने की बात है. Let me highlight the things. Periodic focal temporal lobe spikes. On a background of slow or low amplitude activity on EEG, periodic focal temporal lobe spikes you will see on EEG. So that is what you will see on EEG. So MRI, CT and EEG findings, these are important in HSV only. So you have to remember that. Now let us see a few images. This is the T2 weighted MRI, but this is the CSF is absent in here. So it means this is T2 weighted, but it is flare image. What are the areas involved? This is the temporal lobe. This is the insular cortex, right? So insular cortex and temporal lobe are involved. These two are involved. It is suggestive of HSV encephalitis, right? Next image is this. Here also you will see what you will see ki on this side there is involvement of this cortex and this cortex, means this is the temporal part, medial as well as lateral as well as interior, and this is the insular cortex, right? Here also it is insular cortex and medial temporal, right? Here it is the coronal section, you will see the temporal lobe involvement. Here also temporal lobe involvement. So it is again suggestive of HSV encephalitis. These focal findings are seen in HSV encephalitis only, right? Now how will you treat? We know that for HSV you have to give acyclovir. How much acyclovir? You will give 10 mg per kg IV TDS, right? 8 hourly for 21 days. If there are neonates, you will increase the dose to 20 mg per kg. But in case of CMV, you will give you will give gencyclovir, foscarnet, or cidofovir, right? So this is the this is the antiviral drugs that you will give in CMV, right? For neonates 20 mg per kg, for adults it is 10 mg per kg. Okay, that is all about acute viral encephalitis. This video will be over now, and in the next video we will be coming up with the chronic encephalitis. Thank you for your patient listening. That's all.